Steve. So happy to have you here on this special edition of our daily health talk. Yes, it's a very special one because of seeing patients not receiving the maximum uh, service they should from a pharmacist, not because the pharmacist is not willing to, but because maybe the patient doesn't know his her right as a patient. So today I'm so glad to be doing this because growing up, I also come down to observe some of the things that facilities, especially hospitals, do to their patients that is not right, it's not supposed to be done by law, but because the patient doesn't know his or her rights, the patient may not even know that his rights, is being infringed upon. So that is why it's important to be doing this, and I'm so happy to be here live, enlightening the public. First of all, I want to say that as if as a pharmacist, there are a few things you need to know about pharmacists. Pharmacist is your servant when it comes to drug by law. We took this. Okay, let me just read something. By any pharmacist licensed, I'm actually reading from my license. Any pharmacist license, you say your name, those address, having duly paid the prescribed fees, hereby licensed to practice as a pharmacist under the Pharmacy Council of Nigeria, at 22, in Nigeria, and is authorized to import, export, mix, compound, prepare, dispense, cancel, sell, procure, distribute drugs, medicines, and poisons. These, it give a little summary about what the duty of a pharmacist is, rather, especially when it comes to Nigerians. So when you are standing before a pharmacist, you should know that this person is duly licensed to provide these services for you. The person is licensed to import, licensed to export, licensed to mix, licensed to compound, licensed to prepare, licensed to dispense, licensed to counsel you. Yeah, so it is your right if you are requesting for counseling. A pharmacist is also a counselor. By rights, this is professionally he's a counselor. He's a drug counselor. It's also called pharmaceutical care. So where we provide, you know, provide counseling. Yes. So it is your right. If you come also in counseling, see that counseling has, its own is a topic for another day, but just know that it is the duty of a pharmacist to counsel you. So that when you come to a pharmacist and he or she is taking your time to tell you one or two things, don't get angry. This is your right that is actually giving you. It is his responsibility, but your right to receive the sauce. So he also sell, he also procure, he also distribute drugs, medicines, and poisons. This is the duty or what he or she is licensed to do. So that's being keep aside. I want you to know that pharmacy as a profession is people we took oaths, yes, to enter into this profession, and just like I said earlier, that your pharmacist is your drug servant. He's your servant. He's there to serve you in any capacity within his strength or expertise to serve you as regarding drugs. We took an oath, and in the first line for us said, "As a pharmacist, I vow to serve humanity and to support my profession's ideas and commitments." So he vowed first to serve humanity. So that's why you see pharmacists is as though that if they don't even charge you to cancel you just call them on phone. This is what we vow to do, to serve humanity, in any capacity within our limits. So and several other things. I would, okay, let me just go down. Say, I shall be guided in all dimensions of my life by the highest standards of human conduct and accordingly, and perform my services and duties with devotion, dignity, discretion, and honor. That I shall apply the full measure of my knowledge, skills, and abilities to providing, to improving the health and well-being of all those I serve, and place their needs above my personal interest and consideration. We took this oath to fully serve you. So it is an error if you come before a pharmacist and you're not maximizing the content of their oath. Yes, because sometimes you feel that you are sick. You are not doing us any good if you don't feel free around us, because this is your right as a patient. We have vowed to do this for you. So it is quite unfortunate when you come to a pharmacist and you're frightening. You feel like you're not supposed to say one or two things. In this video, we're just trying to let you know that a pharmacist is your friend. He's your servant. He is there basically because of you. He's there to serve you. You should just know that. So you are not bothering the pharmacist if you get committed to uh, maximizing the expertise of the person, maximizing what the person has to offer as regarding your health. I said, I shall treat, okay, I've said this, okay, I shall treat all those I serve equally, fairly, and with respect, regardless of gender, race, religion, culture, or political belief. So when you come before a pharmacist, you need to know that you have rights of a certain level of confidentiality. Let me not talk about confidentialities now. For you to know that a pharmacist has vowed not to be biased. A pharmacist has vowed not to treat you unfairly because of your religion. He has vowed not to treat you unfairly because of your gender, because of your age, because of your race, because of your culture, because of your belief. This is he. If you sue him for such violation, you win, because it is enshrined in the content of his oath the day of his induction into the noble profession. So you need to know that you have the rights, whether you are a Christian, a Muslim, whatever religion you belong to. You just need to know that before a pharmacist, he sees you very neutral. So you have the right to sue him if he begin to go, begin to criticize you, discriminate because of your race, because of your gender, where you're coming from, your culture. He was not licensed to criticize you. His duty is to serve you equally, treats and serve you equally, fairly, and with respect, regardless of those things. So you need to know that you have this right as a patient to receive this maximum service from him as a pharmacist. And the next one said, I shall protect the confidentiality of personal and health information entrusted to me. So, when you get to know some of those things, it will help you, in approaching a pharmacist with boldness. He has the full, by law, he is to protect your confidentiality, and whatever information you provide to him, nobody is supposed to hear it anywhere except with their consent. That is your right as a as a patient. So before a pharmacist, you need to be free. Some persons don't are not free to communicate to a pharmacist about certain things that are somehow personal to them because of fear of confidentiality. You need to know that as a pharmacist, we took an oath of confidentiality. So your secrets or your history is safe in the hand of pharmacist. So you need to. I appreciate so many patients that when they come, they open up, and they tell you one or two things that nothing concern us with discussing the matters regarding their personal life. So you need to know that as a patient, Your confidentiality, your personal and health information is so confidential and is safe in the hand of a pharmacist. And any person that violates such, you know, confidential, such this rule, you have the full rights to sue the person. You have the full rights to drag the person to any length. You have the capacity to drag the person because the person is violating his vows. So we vow the day we are doing it with happiness, and we know what we are doing. So by being a pharmacist, the person is ready to serve you, knowing full well the implication of violation of these vows. He knows that your confidentiality, your personal and health information should be kept, very confidential as much as possible. And he also vow to maintain and improve our personal knowledge, the competent through that one is personal. So I think to a great extent, okay, so I shall use all opportunities to develop collaborative practice with healthcare professionals in my environment, committed to nurture the care. I shall not use any my knowledge of drugs, disease, and medicine to cause injury to humanity. So that's why I said in the beginning that you are safe in the hand of a pharmacist. So any injurious uh, impact by virtue of the service of a pharmacist, you have the right to query such because by law you have vowed not to use your knowledge to infringe on the health of people, inflict injury on the health of humanity. So there are practices that it is so illegal. So when you see such a thing happen as a patient or a patient relative, you have the right to raise an alarm. So basically, where I truly want to measure is the fact that before a pharmacist, just know you have the right to get whatever knowledge of whatever knowledge you wish to ask as regarding drugs from him. Don't just take drug. You have the right to refuse to take a drug without having to know some things as regarding the drug. Stop taking drugs sheepishly. Drugs are poisons. Drugs can harm. Drugs can kill. So stop taking drugs without getting to know some things about the drug. You have the right as a patient to ask the pharmacist, this drug, what is it for? You have the right to refuse to take a drug that is not labeled. In some hospital you see patients, you see them dispense drug without labeling the drugs. There is no name. The patient moves out of the facility without even knowing the drug he or she is taking. You have the right to refuse to take that drug until it is labeled. That is your right as a patient. You have the right to let the pharmacist explain to you the work of that drug. You have the right to ask the pharmacist anything as regarding that drug, the side effect, what you expected, what you expect to see when you're going to take this drug. Any question very possible that you want to ask the pharmacist, just know you have the rights, and it is his responsibilities to do what? To provide, to provide you with such informations, to feed you with such informations as regarding drugs, because this is his area of expertise. He's licensed to do this and to do it very well with every of the expertise he has gained through school, through experiences. He vowed to do so. So you are not well, let's say, inconveniencing him. You are actually making him to do the things he is supposed to do. As a matter of fact, a pharmacist is not supposed to hand over drugs to you without telling you one or two things about the drug. No, he's not supposed to just hand over to and say, take money now. No, you need to tell you one or two things as regarding probably what you may expect from the drug. Some things, if this thing happens, is what you need to do. If it happens, it's normal. This kind of, there are he has it is his responsibility to do that. One of our colleagues, when we were doing internship at AE Futa in Abakaliki, she once told us that she worked with a pharmacy, I think in the US or in the UK, and then when he bought the drug from the person, he wanted to leave. The person said no. As the person was trying to tell her one or two things, she told the person, I am a pharmacist. I know about all those things. She said, if you're a pharmacist, you should know that it is my responsibility to tell you all those things. So by law, you have this right to query a pharmacist as a getting drugs. You have the right to refuse to take a drug because you are not cleared. A drug is not supposed to be enforced on you. You have the right to refuse to take the drug because you are not cleared. And you have the right to walk out of that facility to go to any other place that you know that your questions will be clarified, and then whatever fears in your heart, you know, clarify before you take the drug. So this is your right as a patient. That you have sickness doesn't mean there's anything wrong or that you are bad. No, that you are a patient having one sickness or another doesn't mean that how will I put it now? It doesn't mean that those rights have been denied of you. No, you have the right to get whatever clarifications you need from a pharmacist prior to taking a drug. Don't take any drug without being sure, without being convinced. If you are not convinced of taking a drug, you don't take a drug. Even in our facility here where we do, basically HIV management, you don't force a patient to, get enrolled on treatment. The person has to take his or her time and give you consent that he or she is ready to commence his drug. So you need to know that you have the right to refuse, because you feel this drug is not safe for you. You feel there are things you are not being told about the drug. You have the right to refuse treatment until when you are clarified to commence treatment. So this among many other things are your rights as a patient. So I want you to know that pharmacists are always there to assist you, always there to help you, especially when it comes to drugs and what drugs does to the body. So I think it is important that you utilize them. Globally, it has been, I think there was a test that was done. See that pharmacists are virtually almost the easily accessible profession. So, and they are very much near to the community. You have community pharmacists everywhere. So, as you approach them, see them as your friends. See them as people that are already equipped, ready to serve you, because the first, line in your portrait as a pharmacist that vow to serve humanity. So we vowed first, we vowed our service to humanity and to support our professional ideas and commitment. So this is what we vowed without even you being in the picture in the first place. In the whole training we passed through on campus and some other things, we have come to vow that this is what we've come to do. So see them as your friends, relate with them, be free to ask them any question, be free to call them on phone to ask them, but most importantly, learn how to appreciate your pharmacist, because many persons they would know how to get the service of a pharmacist, but they will not still know how to appreciate a pharmacist. Learn how to appreciate your drug laws, your pharmacists. Learn how to appreciate them. Learn how to show them love. To encourage them to as they serve humanity. So, for example, the day 25th of every month of every September is always World Pharmacist Day. Learn to show them love. Learn to celebrate them. Show a pharmacist love, even as they are committed to your health needs. So please see pharmacists as your friends, even if you have sickness, whatever sickness or how terminal the sickness may look like, be open to him, because your confidentiality is safe with a pharmacist. Your confidential, yeah, your secret your personal and health information is safe with a pharmacist. He vowed to keep your information very confidential. So please relate freely with the pharmacist, and please to be professional. Your relationship, be professional, please. In your relationship to a pharmacist, ensure that you relate with a pharmacist with a high level of respect, and honor to and dignity to the profession. Is a noble profession. That you have this right doesn't mean that you have the right to talk to a pharmacist anyhow. A pharmacist have his own rights to implement against you too. So as he is ready to serve you, please encourage him to make it better for him to serve you well, because many times the pharmacy can be so overwhelmed with populations of people to attend to. So be human as you relate to the pharmacist. You don't kill somebody that is there to serve you. So what are we talking about today? As a patient, you have rights before a pharmacist, and you need to go into this with a friendly heart, a lovely heart. Just know that it's not a fight. He's there to serve you, and he's ready to serve you. Be open with him, cooperate with him. If you ask one or two questions, just be open. He has the right to ask you, get history about some drugs you've taken, many things, so that you'll be able to make his judgment as regarding the prescriptions before him from a doctor. So please, your pharmacist is actually your friend. You can be open to the person and receive the necessary care. These things we are talking about is to your own best interest. Even if you don't open up, if you die, the pharmacist's life continues. But then you knowing all those things and maximizing them is to your own best interest, so that you can receive the maximum service and care that is necessary for your life. So thank you so much for being with us through to the end. Please, in case you're following us all this while and you've not subscribed to our channel, you are not doing us any good. So please encourage us to grow on this platform by clicking that subscribe button you can see on your screen. Please don't forget to turn on your notification bell. Don't forget to like and comment, even if possible. And I know it's possible because you can press that share button and share the link of this video to your friends, so they'll be part of what we're doing over here at Manifestation TV. So thank you so much once again for being with us through to the end of this live broadcast. Don't forget, this Saturday being the 20th, sorry, the 12th of October, we're releasing our first video tag, our first movie tag, The Careless Anointed Pastor, and the internet is already on fire, as we are waiting for the release of this movie. Please encourage us by sharing the link of that movie when it comes out. And please don't forget to, comment, don't forget to like, don't forget to share when it comes. Let there be massive, sharing of that movie when it finally lands this channel. Thank you so much as you continue to cooperate with us and help us to grow this channel, however possible within your limit and capacity. Thank you so much, and see you tomorrow as we continue on our daily health tips. That we started yesterday. Today is the day 2, and I know it's getting interesting. Tomorrow will be the day 3, as God gives us grace and strength to continue on this platform. Thank you so much, and see you tomorrow with much love from Manifestation TV family. We love you.